a little bit for the rest of participants, but I think the people will connect, and I think we need to start already. So now I'm very happy to present here, to have here with us Dr. Gabriel Sikir, who is a leading medical aesthetic physician, internationally recognized and well-known doctor. He provides hands-on international trainings. He's a well-known speaker during the most important international congresses. Of course, he is also a founder of 2 clinics, Dameto clinics, and we're very happy that he always accepts our invitations to work with Suisselle. And today he will share his experience and his very deep knowledge of the products that we present by Suisselle Cell Booster. Please, Dr. Siquier, your turn. Thank you.
Thank you very much.
I will interrupt you just 1 second. For the audience, please, if you have questions during the time Dr. Siquier gives his explanations about the products, please write them in questions and answers. Okay, he will pay attention only to those questions, not into the chat. Thank you very much. Sorry, Dr. Siquier. Thank you.
Thank you very much for the presentation, Katerina. I'm Dr. Gabriel Sikir, and today we are going to talk about Cell Booster and how to do global men rejuvenation with this product. As you know, I'm founder and medical director of Dameto Clinics International, with clinics in the Netherlands and in Spain to university level. I'm part of the NEOMA research group in the University of Girona, and I'm certified doctor both in the Netherlands and in Spain. If about Suisselle, for the ones you don't know, is a science-driven Swiss company. Is based in Yverdon-les-Bains, and their motto is to strive for evolution and to put the best product quality and to follow as well strictest safety standards. Let's gonna see a video about them, and then we give a little extra time for the participants that they are still joining. A nice impression about Suisselle, and well, the product, they try to have effectiveness, technology, safety, and thanks to that we have successful results, very good results. If we are looking of the main ingredient of the product Cell Booster is hyaluronic acid. Hyaluronic acid has high water retention ability and will help us for moisturize regulation, but also nourishing the collagen, so the extracellular matrix. So I would like to ask you to make it a little bit interactive. Which one do you think is the main function of the hyaluronic acid? So here you have a poll and you can vote on the poll. So what do you think is biorestructuration, biocomplementation, or hydration? Okay. So I see that there is a little trouble. So okay, now you can vote. It's not working, so we're gonna go over it. So it's exactly it's biorestructuration, and when we put some ingredient on that, we are going to be talking about biocomplementation, but also hydration is one of the key elements of the hyaluronic acid. What's happening with hyaluronic acid once we inject it is going to be easily degraded into fragments by hyaluronidase, the UV exposure, pollutants, chemical stress. So we are having a short life once we inject that product into the skin. CHAC technology is able to enhance and exploit the natural properties of hyaluronic acid, both making it an optimal vehicle for transporting the essential nutrients, so the active ingredients we are going to put into the formulation, and ensuring an effective delivery. This will allow us to have faster, but also enhanced and long-lasting results. CELLBOOSTER is Swiss patented technology by Suisselle, and we have 3 different steps to stabilize mechanically this hyaluronic acid. The step number 1, we're going to form a hyaluronic acid matrix thanks to high pressure and shear deformation. The step number 2, we're going to integrate the active components into the structure of the hyaluronic acid matrix. So, and we are going to create some links. These links, they are called peptide links between the hyaluronic acid and the active ingredients. And the step number 3 is when we finally have the formation of the 3-dimensional structural CHAC complex, where we have already integrated the active components. CELLBOOSTER is unique CHAC technology, so we don't have any chemical binding agents. We're going to have a slow and progressive release of the active ingredients, and we have unique complex ingredients combination in each formulation to achieve results on the specific indications of the product. CELLBOOSTER is a class 3 medical device, so that means that it's safe, is effective, but can also be injected. We have a range of 4 products. We have CELLBOOSTER Lift, CELLBOOSTER Glow, CELLBOOSTER Shape, and CELLBOOSTER Hair, each of ones with specific indications that we're going to see through this webinar. So the CHAC technology, as I told you, we have these 3 different phases. It's patented technology, and we don't use any chemical binding agent or any stabilizing agent to make the formation of the CHAC complex. So which ones are the benefits? Well, first of all, this complex will protect the ingredients from the endogenous hyaluronidase, will increase the bioavailability of the active ingredients into the formulation, will optimally distribute the active ingredients to boost efficacy, and as I said before, is a unique proprietary method to stabilize the hyaluronic acid. With that is a combination of shear deformation and simultaneous pressure once we added the vitamins, the amino acids, the minerals, and the microelements that we have into the formulation. Let's go and see a short video about it. Well, it was very interesting video, and I think it was very good. I see that we are having some problems with Zoom. It's a global problem, so don't worry. The ones you cannot attend, we will have this webinar recorded, so you can join later or watch it later. Sorry about that, but it's a global problem with Zoom. So going to the theme we are talking today, men grooming problems or men characteristics, which ones they're going to be the most important. So we have some areas that the men they are more worried. The periocular frame, the dry skin in men is also a problem, and all the opposite, the oily skin can be also an issue for the masculine patients. So we have some difference between oily skin and dry skin. We can see that the oily skin is more prone to have blemishes and pimples. We're going to find large pores. We're going to have a shiny skin, overactive sebaceous glands. That's going to make it a little bit more oily. And dry skin, we're going to have completely different. We're going to have fine pores, but matte skin, so like no shining. And the dry skin is more prone to wrinkling and other signs of aging. So we need to try with our products to achieve a balance between these two to have a normal but hydrated and healthy skin. Well, another difference we're going to find with women when we are talking about body treatments is going to be the fat location. In the men, it's going to be more focused on the belly, the love handles, but in the women's, it's going to be more centralized on the abdomen and the legs. So we need to adapt a little bit the areas of treatment for our patients. Let's go talk then about Cell Booster Shape. It's new in the range and is indicated for local fat reduction, but also for water retention, and it's going to improve microcirculation. So we can use it as well on cellulitis, for example. That's a chronic edema that is creating this problem into the tissue. The indications will be localized fat accumulation. Be clear with that with your patients, because it's not to reduce weight, it's to help to remove localized fat deposits. For sagging skin, double chin, but sometimes we're going to have fat lower cheeks, cellulitis, water retention, puffiness, edema on the malar area. We can also use this product to have a successful result. Which ones are going to be the key ingredients? Hyaluronic acid, of course, with 18 milligrams in a 3 milliliter vial. And then we're going to have vitamin C, and L-carnitine. The combination of these two have been used for a long time, but what makes unique the product is the progressive release, because the stabilization of the product allows to be in the tissue for around 2 weeks. So we're going to have progressive release of these two ingredients into the tissue to help to remove this localized fat and to reduce the localized edema as well. We have a program on intensive course, 3 treatments bi-weekly, and then we can do support course 1 month, depending on the needs and the wishes of the patient. So sometimes you know that cellulitis is a chronic component, so maybe we need to repeat every month or every 2 months, 1 session to maintain the results. The treatment areas, the face, the neck, the décolleté area, the back of the hands, the internal face of the arms, but also as well the body. L-carnitine reduces the local fat accumulation, the water retention, and the puffiness. What it's doing is the decomposition of the long-chain fatty acids with the acetyl-CoA release that will normalize the metabolic processes, will stabilize the cellular membranes, and the skin salt-water balance that will stimulate and fastens the reparative processes and will mobilize the fat from the deposits. It has a drain effect, so will reduce the liquid congestion. Vitamin C is considered a fat-burning workout booster, and the studies have shown that individuals with adequate vitamin C status, they will oxidize 30% more the fat during a moderate exercise. A fat-burning workout will be more efficient when vitamin C level is high, so we are going to have better result while training. The L-carnitine transports the long-chain acyl groups from fatty acids into the mitochondrial matrix, so they can be broken down through the beta oxidation to acetyl-CoA. So we are going to transform this fat into energy. So this process is working completely different from other lipolytics, because, like, for example, the oxycolate, what they're going to do is to break the membrane of the cell, and we're going to have an inflammation, and then the body needs to reabsorb this product, but it's not specific. Will break the membranes of the adipocytes, will break the membranes of the muscles. With L-carnitine and vitamin C combination, we're not going to have that trouble. So we're going to have a progressive reabsorption and mobilization of the fat deposits in a different way and transforming it into energy via the mitochondria. Cell Booster Glow, it's another one in the range, and is indicated for deep hydration, but will reduce hyperpigmentation and fights against the oxidative stress. So will neutralize free radicals and will also reduce the effects of keratosis. The indications or the results we're going to find is going to be reduced hyperpigmentation, improved skin tone, deeply hydrated skin, and we're going to protect the skin against environmental aggressions like can be solar radiation. So we can, with that treatment, we can also have a preventive therapeutic effect. Indications: hyperpigmentation, fine lines and wrinkles. I use that product more in a younger demographic, but also to treat melasma, for dry skin, sun damage, and uneven tone of skin. Which ones they are going to be the active ingredients in the formulation? We're going to have hyaluronic acid, 80 milligrams, vitamin C, again, biotin, and a combination of amino acids. In this case, is cysteine, glutathione, lysine, lysine, proline, and valine. So with a specific action, each one of them. The program is going to be the same because the product is stabilized and stays into tissue for around 2 weeks. So we're going to do 3 treatments with 2-3 weeks interval, and then we can do a support course once a month, depending, or once every 2 months, depending on the indication and the needs of the patient. The treatment areas, remember that we want to have a better activity into the skin, so we are going to inject intradermally, and can be the face, the neck, the décolleté area, the back of the hands, the internal face of the arms. When treating body, I recommend you to use your hand as a measuring tool, a closed hand. So for example, in the décolleté, we will need 2 ampoules if we want to cover a large area. We only need 1 ampoule if we want to cover the middle triangle. That's generally what has the most sun damage. The ingredients to reduce the hyperpigmentation is a powerful combination of glutathione and vitamin C. These 2 elements do an inhibition of the tyrosinase, so we are doing an inhibition on the melanin production pathway. Glutathione is antioxidant and anti-inflammatory, so it will also help us to control post-inflammatory hyperpigmentation. And vitamin C, besides being an antioxidant and an inhibitor of the tyrosinase, is also going to help with the vascular integrity and collagen stimulator. The amino acid blends will supply the building blocks for the collagen repair, so they are essential for a healthy and beautiful skin. We can see here in the melanocyte how the tyrosine via the tyrosinase is transformed to DOPA, and the DOPA again via the tyrosinase is transformed in dopaquinone. The inhibition of the tyrosinase and the oxidation, via via the glutathione and the vitamin C. So we are gonna stop this process. We can also inhibit other steps on the formation of the melanin. So at the end, what we are gonna have, we are gonna block the melanin synthesis, and we are gonna block also the melanin intercellular transmission, so that will result in less melanin production and less deposits of melanin without being toxic for the melanocyte. So it's not like the hydroquinone that can be toxic for the melanocyte, so we can have hypopigmentation if we remove all the melanocytes there. So we are working more to cellular levels, understanding the pathway, how we can act, and with very specific ingredients to achieve these results. The technique we're going to use is going to be papula with injection angle 30 degrees, and normally with a needle 32 is 4 millimeters is the general one we use for intradermal injections. But nowadays we have other needles that they are smaller that we can also use 33 or 34G. 4 millimeters depth with an angle of 30 degrees. We're going to be intradermal all the time. If you like to work with cannula, you can also do fanning technique, but the idea is to put the product a little bit superficial, so we are going to work on the hypodermis. When we are working with micropapula in specific areas that we have accumulation of hyperpigmentation, we can define these zones with your marking, and we can do more injections, more product on this specific area. Cell Booster Lift is the third one we have here in the portfolio, and will diminish the aging effects and will stimulate the collagen production, improves microcirculation and cell nutrition. I normally use that product for a little bit older demographic that they need skin redensification and they're wishing to have more lifted skin and smoother wrinkles. Besides that, it will also improve the skin tone and the microcirculation. The indications then will be loss of firmness in facial tissue and contours, dehydrated skin, wrinkles, skin laxity, loss of skin tone and elasticity, and we see that we also have nice results in cuprosis. Which ones they are going to be the key ingredients of Cell Booster Lift? It's going to be hyaluronic acid, 80 milligrams, a specific cocktail of vitamins with riboflavin, vitamin C, tocopherol, vitamin E, and biotin, and a specific mix as well of amino acids, arginine, glycine, lysine, proline, and valine in this case. The program is going to be the same. We have an intensive course of 3 treatments with 2-3 weeks interval, and a support course once a month, depending on the indication and the needs and wishes of the patient. The areas of treatments, we can use it on the face, the neck, the décolleté area. The back of the hands has high demand for that treatment, but also the internal face of the arms and some specific areas of the body. The key active ingredients in the formulations is the amino acids with hyaluronic acid will both help to have a skin redensification with deep hydration, stimulate the microcirculation. So what we are going to do is going to improve the skin tone, the elasticity, and the smoothness. And we're going to have the elements to stimulate the collagen synthesis. So we are going to support remodelation and healing processes as well. The vitamins, we're going to have skin defense, promote and will protect the cells from the free radicals and the oxidative stress. Oxidative stress to cellular level is what makes our skin to age. So we're going to prevent lines and wrinkles with that treatment as well. Which one is going to be the technique? We're going to have the same intradermal, but in that case, if you wish to use the cannula, it's not a problem. We can do a fanning technique, also working on the hypodermis, and we will need around 3 milliliters for the full face. I normally use a Cannula 25G or smaller if you wish, and then on some specific areas like periocular, if you wish to use also micropapilla, it's a delicate area of treatment. So we're going to see a video in a minute how to use this product. Cell Booster Hair is one of my favorites and is a device designed for strengthening the hair follicles. So we're going to improve the hair growth and the microcirculation, and we'll also restore the scalp skin structure. So we'll provide hair fiber restoration. So we're going to have a better hair quality. Remember that it's designed for strengthening the hair follicles. So if the hair follicles they are disappeared, we cannot stimulate a new growth of hair follicles. So how earlier do you start the treatment for your patients, more hair follicles you're going to have, so you are going to maintain them, you're going to have a better hair growth acceleration, so you also going to have a better result. The indications, there are all types of non-cicatricial alopecia. Non-cicatricial alopecia, you can have you're not going to have hair follicle damage, even though they can have some metabolic changes or they can fall into resting phase for more time. You're not going to have hair follicle damage. So it's important that we don't try in cicatricial alopecias this product, because it's absolutely not the indication. I would say that is contraindicated. The general ones, they are alopecia areata, androgenic alopecia, premature graying, but also we have nice results with seborrhea. I will show you one case I presented this year on the Incas World Congress. Which ones are the key ingredients? We have hyaluronic acid, 80 milligrams. We have a cocktail of vitamins, niacin, pantothenic acid, that's vitamin B5, B6, B7, B12, and rutin, and again, a cocktail of amino acids. The zinc and the biotin regulate the activity of the sebaceous glands, so will slow the senescence of the hair follicles and they will prevent the premature graying. A point on that is that when we are starting to have alopecia, the hair follicle is, we're going to have diminished the size and diminish the capacity of producing hair. So we're going to have not deep hair follicle. It's going to be a little bit more superficial with low capacity of producing pigment on the hair. So that's why we say that it prevents the premature graying. We're going to have a better color in the hair, but it's not a dyeing product. If you are completely white, you're not going to get brown again. The zinc and the copper, they are released consequently with the help of the CHAC technology. We're going to see it later, specifically how it works. Then we have niacin, that is effective antioxidant as well, and pantothenic acid, vitamin B5, that will also prevent the early hair graying, can restore the natural color, and is also responsible for a proper hair growth. So all the ingredients we put in the formulation, they have a specific activity to help to restore the shape, the thickness of the hair, the vitality of the hair follicle. So to try to reverse the miniaturization of the hair follicle, that's what happened during the alopecia. The amino acid blends will reinforce the hair fiber. This is one of the things that the patients will notice the first, because they have a better hair with more body, more thick, more healthy looking, and the hyaluronic acid will hydrate and nurtures the skin. Is, you know, is a water attractant polymer, so will improve the ambience where the hair follicle is located. So we're going to have a better chance of a faster growing and a faster promotion of more hairs per follicle, so we can have a better result. The zinc and the copper, they are competing for the same receptor, and we see formulations in the past normally, or they got zinc or they got copper. Thanks to the CHAC technology, we are going to have a progressive release, so it's going to be liberated. The zinc that you know is a cofactor involved in more than 80 protein synthesis, will help to have a seborrhea regulation, and is a mediated anti-androgenic effect because it's an indirect inhibitor of the 5-alpha reductase. And then we're going to have the copper as well with anti-inflammatory effect, antioxidant action, and is an essential trace mineral for the chromogenesis. So will also help to restore the pigmentation of the hair. The way to inject is with micropapula or a Napash technique. You can also use an injector device. The depth of injection is important. We need to be intradermal as well, because it's where the hair follicle is located. So I recommend you to use a classical mesoneedle, 32 or smaller, with 4 millimeters with a 30 degrees. So we are going to be sure that we are always intradermal. Let's go and see some treatments. Here we can see this male. We selected the area of injection, and you look that I'm injecting all the time. I'm injecting with a 33G needle on the first video, 34G needle. It doesn't matter. You need to use the one that is more comfortable for you, or the one that is more comfortable for the patient. Sometimes I even mix with chilokine with adrenaline, put 1 milliliter in the vial to make it more comfortable for the patient and to reduce bleeding. But we need to inject on the area that there are still hair follicles. The areas that we don't have any hair follicle, it doesn't make any sense to inject that product, except on the alopecia areata, that we're going to have areas without hair, and when we inject there, that we're going to have the hairs there on all of them on resting phase. We can reactivate them. And we're going to notice that when the hair starts to grow, it's going to be white on the alopecia areata, because the hair follicle doesn't have enough capacity to pigment the hair. But later we'll get on the normal color again. Another frequently demand on the men is alopecia areata barbae, and normally it's related to stress or other immunological functions, and we simply select the area that has less hair, or that the patient has more need, and then we are going to proceed to do the injections intradermally as well. Remember that the hair follicle cycle on the beard and on the eyebrows, they are different than on the scalp. On the scalp, it's going to take 6 months to have the full result. On the eyebrows, can take even to 9 months to have the full result. So it's also important to explain to the patient that we have these timings into the process of the hair restoration. Let's going to see a little video on the vertex area of the patient. Normally, I use a concentric treatment plan, because, as I told you, sometimes I mix it with a little bit of lidocaine, and if I do this concentric circle, we can be a little bit painful on the exterior, but then on the interior, it's going to be very, very comfortable for the patient. You see, it's not any secret, easy to maintain, and the patients are really happy with the result. This is the case I was presenting and this year at the INCAS 23rd World Congress. And we can see also not only the control of the seborrhea activity, but also the pigmentation on the hair. And then on one side before treatment, we have a wispy white hair, very thin. And after treatment, we have a more thick, more pigmented hair and the control of the seborrhea treatment. Seborrhea can lead to alopecia because the inflammatory process makes it more difficult for the hair follicle to grow into normal ambience. So once we control the seborrhea, we can also have a better hair quality. Here we have another result before and after treatment. In that case, it's a woman, and we see also the same: better pigmentation, better body on the hair, better healthy structure, and probably more hairs per follicle, so higher density on the scalp. In that case, was a patient with an hormonal imbalance, and once was controlled, we help to the recovery of the hair follicles. Let's going to see the areas with more demands in the men, and we see that they are periocular, the perioral area, but also the neck area. We have a demand to have a better shape on the jawline. So we got the trigonum submandibulare, the trigonum submentale is an area that we can treat to reshape the face of the man to make it more masculine effect. The trigonum submandibulare is, and the double chin is also an affection on the men, and to control, to reshape these areas, we will have a more younger, more masculine appearance. How we need to treatment, we can also combine them. In that case, I'm doing a treatment with Cell Booster Glow to equalize the tone and the hydration of the skin, you can see that I'm working intradermal 34G needle. Remember, to extract the product from the vial, we will need a bigger needle, 18G, for example, to extract it from the vial, and then we change the needle and we put the needle or the cannula for the treatment. We can also use cannula, and we can do treatments in other areas like the décolletage. Let's go and see some videos about that. In that case, we're going to select the area with more sun damage, and we are going to do a marking of the area. Remember that normally one close hand will be the area of measurement for one full ampoule. And we are going to proceed with the injection intradermally. In that case, we are injecting Cell Booster Lift because it's an older lady, so we want to redensificate the area. Men also has this demand on the décolleté because they're in summer, they are more prone to wear an open shirt or a t-shirt with a v-neck. So we can also do these treatments in men to improve the quality and to reduce sun damage, but also to prevent the sun damage. You can use topical anesthetic, and you have enough space in the vial if you wish to put some liquid anesthetic like lidocaine or lidocaine to make it more comfortable for the patient. Other areas, sometimes on the necklace lines, we see that we need a redensification, but sometimes I don't know why. We also have hyperpigmentation on these specific lines. So we can inject directly. You can inject micropapilla, but you can inject linear retrograde, with, in that case, I use invisible needle. I think how smaller is the needle, more comfortable is for the patient. I'm entering almost parallel because I want to be intradermal all the time, and I want to reduce bruising. Look how I'm tensing the skin to have a better needle gliding and a better positioning of the product. Okay, you see it's almost no bleeding, and if you touch a little vein, a little vessel, the hole is so small that with a little pressure will be closed in a minute, so you're going to avoid to have ecchymosis after treatment. You can combine them, so in that case we are going to select the area with hyperpigmentation. That was done because bad positioning of the sunblock. So she put it very good on this part of the neck, but on this lower part not. So she has this burning and with post-inflammatory hyperpigmentation. And then I'm gonna redensificate also. You can combine Cell Booster Glow with Cell Booster Lift, so you can redensificate and then treat the hyperpigmentation. And if you want, you can combine it in one session, treating different areas. That's no problem at all. The maximum amount I will recommend per session in total will be 30 milliliters. It can sound too a lot, but if you are starting to treat body, you will see that the number of vials increase quickly. Cell Booster Lift with cannula technique is also very easy and effective. Normally I use 1.5 centimeters per hemiface. In that case, I'm using a 25G cannula. And you see that I'm gliding because I try to be very superficial. I want to put this product into the hypodermis. I don't want that diffuse to lower tissues, to lower planes. And linear retrograde fanning technique, be very gentle, hand tense also a little bit the skin for a better cannula gliding. Remember that you don't have to touch the cannula with the glove, and the proper disinfection of the skin, it is a must when we are using cannula, because we have more risk to transport any impurity inside the face. Body hyperpigmentation, here we have some results courtesy of Dr. Natalia Mikhailova, before and after trauma. So we can also use Cell Booster Glow on the body with very nice results. Here we have another after traumatic. We can see the reduction of the melanin in that specific area. Combinations, Cell Booster Shape and Cell Booster Lift is the most demand for plus 40 patients, and combination with Cell Booster Glow and Apriline Hydro is also the combinations that we have more and more into the practice in our clinics. For example, in that case, I'm going to treat the trigonum submandibulare and the double chin. I'm pinching the skin because I want to place Cell Booster Shape into the subcutaneous fat. That was the male patient that we treated with Cell Booster Glow the face, and now we are treating the trigonum submandibulare with Cell Booster Shape because we want to redefine a little bit the mandibular angle. We want to reduce the fat on this area. Remember that I'm pinching for around 1 centimeter, and there I inject into the subcutaneous tissue small boluses, 0.1, 0.2, depending on the need of the patient, and we're going to do 3 sessions to achieve the result. Remember that is not a product to lose weight, and sometimes can be a little bit tricky when we explain this to the patient, because they come with overweight and they think they have a double chin, but it's not because they have localized fat, it's because they have overweight. So better to recommend them to control their dietetic habits and to have a more active lifestyle. And then when we have the localized fat, that will be the indication for cell booster shape. Other areas of the face where we have also indication could be the malar area. Sometimes we have edema. Cell booster shape is also working onto edema and malar fat pad excess. So here I pinch the skin again, and I'm going to inject subcutaneously. I could inject more superficially if my only wish was to create a drainage, because we're going to have also a good effect. Lower cheek is also sometimes an area difficult. So to put cell booster shape on this specific area and to have a reduction on the volume will be very good for our patients. On the fat pad situated on top of the nasolabial fold, sometimes we also have an excess of volume, so we could inject on this area, and then, for example, the rest, do it with cell booster lift with a cannula to have a multimodal approach and a better result on the final picture. On the body, bolus infiltration. Remember, when we are treating the body, I would recommend one close hand per area. So in that case, in the belly, I used 2 ampoules, and then I pinch and I inject this particular patient, that's a male, and was training a lot, but was not able to dissolve the fat deposits as fast as he wanted. So we did the treatment, we injected bi-weekly, and we help, you know, that with vitamin C at 30% more reduction on the fat deposit we are going to have. And it's not like other products that we can find, traditional mesotherapy, that you need to repeat more sessions with that product. Thanks to the stabilization through the CHAC technology, we are going to have a more faster result and better result than with the other ones, because it's like every day you are providing this vitamin C and this L-carnitine into the body. Love handles, also an area with high demand in the men. And now we are having more and more people with following specific trainings online and things. So it's good to help them to achieve the result a little bit faster without the worries to have an inflammation or complication, because it's a very safe product to use, but also very effective. Here we can see result. We have a better definition. This patient is also training, so has a better tone, but this little excess of fat on the abdominal area and on the love handles, we can see a better shaping of the body, better definition on the body. Let's, if you wish to use cannula, that's also possible. Some patients, they are bruising easily. We could use a 25G cannula, and we can place the product subcutaneously. Remember also the injections, that the main veins or arteries, they are close to the navel, so we're not going to inject around the navel, but we can get 2 centimeters close there, and we will not have any trouble. And then simply a bit the skin for better cannula gliding, and then simply linear retrograde. We are placing cell booster shape, and then we wait 2 weeks. We do another treatment, 2 weeks. We do the 3rd treatment, and then we have still to wait 2 weeks to have the result. It's going to see specific area that is the periocular area. Sometimes we not only have volume loss on this area, but we also have hyperpigmentation. I love to combine Cell Booster Glow and then another session Cell Booster Lift, then another session Cell Booster Glow, another session Cell Booster Lift, and then I consider if there is a volume loss. But here we can see that this patient has hyperpigmentation on the area, and with a meso technique, micropapilla technique, we can get closer to the eye without big risk. This product is not reticulated, so don't worry, you're not going to have permanent edema there. If you put too much product, you can have temporal edema, but will reabsorb and will dissolve in a few days. Also be careful when we are getting closer to the eye. It's the thinnest part, it's the thinnest skin of our body. So try to use very thin needle to enter almost parallel, and we can place slowly the product. Micropapilla is the ideal technique for this area. If you do it properly, then you don't need to have any sort of bruising. Anyway, if this happens, you can put mineral makeup for a few days till disappear. Compression after injection is important to avoid bruising. But you can see here I'm using 33G needle, so the hole is very little, so maybe you're gonna have a little spot, but generally no, not more trouble. Here we can see the result. In that case, it's a lady, but even though I use some fillers for lifting the face, the biggest change we have it on the skin quality, and that is a thing that Cell Booster can give to you. Better skin quality, better tone, better hydration. So definitely a must-have in our clinics. So that was the presentation for today. I'm sorry about these Zoom complications, but let's time for questions, and I'm going to look on questions and answers only. So let's see. They have a question that says, safe to use Cell Booster products in autoimmune patients? Well, it depends on the type of illness, but generally it's no problem to use this product. Can be patients with endocarditis, patients that they are having exacerbation of their autoimmune illness, like lupus or something like that. But remember, Cell Booster has a lot of ingredients, so the major risk that you can have and the absolute contraindication will be an allergy to any of the specific ingredients that we have into the formulation. So in this sort of patients, I will do an allergy test, but generally you're not going to have trouble. Yeah. So I think if you have a patient that is well managed by the rheumatologist doctor, and so you don't have a direct contraindication. Direct contraindication also will be, for example, infection on the area, or bad managed illness. At the moment, patients, they are sick with fever, we don't have to treat them until they resolve this episode. I don't know if there is any other question. But otherwise, because we got some trouble with the Zoom online, you can send the questions to your distributor, and we will try to make an answer sent to all the participants by email. Maybe Ekaterina could be an idea.
Yes, it's a very good idea, Dr. Siquier. You can send the questions or to your distributor or to our email address, info@suisselle.ch, and we will, of course, answer all the questions. Once again, I'm really sorry for the inconvenience. It was a global problem, IT problem on the Zoom platform. So we were a little bit of victims of this IT bug. So Thank you very much, Dr. Siquier. We're really grateful to you for your nice presentation, very interesting subject.
My pleasure.
Our pleasure. So see you again very soon. Thank you. Thank you.
Thank you. Bye-bye.
Goodbye, everyone.